Hello and welcome to the Moms Who Know podcast. I'm your host, Chanel Nielsen, and I'm joined today by Kim Maravich. Kim, thanks for being on the show.
Thank you so much for having me, Chanel. I really enjoy your podcast and I'm just thrilled to be on it.
Thanks. Well, I'm excited to have you. So Kim is an author and we're going to get into her book in a little bit here, but I want to tell you a little more about her. So she is a mother of two. She's a boy mom like me. I'm a boy and girl mom, but mostly boys. So I get the boy thing. She is a wife, a registered nurse, and a former elementary educator. She's an author, and her book is called 360 Health, Your Guide to Cancer Prevention and Total Body Wellness. And so I am excited to have you today and to talk a little bit about cancer prevention. That is a big topic, and I think something that we hear a lot about, and yet there's a lot of confusion about it too, because everything you read is like, this causes cancer, this causes cancer. And I think that it can be almost easy for people to want to throw up their hands and be like, well, fine, then I just, I can't do anything. And so I'm just going to live with the risk,
Right.
Kind
exactly.
of go the other direction.
That's right. It can be very overwhelming.
Definitely. So let's start off. Now, you're a registered nurse, so you're in the health field, but what got you interested in cancer prevention specifically?
So a little bit about my background. I started off as a registered nurse and working in cardiac care in a hospital. And I quickly realized, after I began nursing that I really didn't care for the emergency-ness of everyday life, working in a hospital unit. And it was frustrating to me because so many people that are admitted to the hospital these days, are very, very sick. Usually people are not admitted unless they have multiple things going on, or maybe they are admitted, but just for an observation. So it became very overwhelming working in a unit. I might have 6 patients at a time, and all of them very, very sick. Like I said, I worked in cardiac care, but it wasn't uncommon for them to also have cancer or diabetes or multiple different things happening. So what I did, and you mentioned that I was an elementary educator, I actually ended up leaving the hospital setting to go and work in an environment that for me was a little bit more uplifting. I went back and got a master's in teaching. But all along, I've retained my RN and have done continuing education and everything I needed to do to keep up the certification. So I was a teacher for about 12 years. And then after I had my second son, I decided to resign from teaching to stay at home with my boys. My husband travels just really a lot. And it's always hard, I think, going back to work after you have, especially your first baby. And I did. And it was really difficult. Of course, at first you hate to leave your little baby behind. And,
yes.
Yeah. And that was hard. But, I felt like my passions weren't there as much anymore. I felt like I was giving everything at my job, and then I had not very much energy left for at home. So, point being, after a lot of consideration, my husband and I just decided that, I would be able to stay home with the boys for a little bit, at least for a few years at least. So after that time, I really was enjoying being at home. But I also, as you know, I'm sure, Chanel, you feel like you lose a part of yourself, in that process, that you are, as much as you love your family, at least for me, I was going from working full time to then staying at home. And, who am I now besides just a mom? Well, this is where kind of the nursing background and my love for nutrition just came into play again. I had always been interested in nutrition all along the way. In nursing school, those were my favorite courses. And again, part of the frustration with working in a hospital was just that knowing that so many of these diseases that some of the people had could have been prevented was frustrating, coming from, and that at the time was just more or less a hobby for me. I was the kind of person who would go to the beach and read books on like health and nutrition versus, the novels and the fiction and the love stories.
Right.
And it was, just always sort of funny. So what I started doing when I was at home with my boys was just for fun, writing articles. And it started to click in my mind that a lot of these foods that I was researching and coming across had some new discoveries in cancer prevention. A lot of them were what you would call anti-angiogenic, which are foods that can actually have been studied and can actually turn off the blood supply to cancerous tumors. So angiogenesis is the abnormal blood vessel formation that occurs when someone has cancer in their body. And it's also the beginning of what can lead to metastasis. So I just found it fascinating that some of these foods were shown to stop that potentially. So around the same time, my husband's mother, my mother-in-law, was becoming very ill. She had had cancer 20 years ago, lymphoma, and she was getting sick again, and she was misdiagnosed. They were telling us lots of different things that were going on with her. And sadly, we didn't really know that she had cancer again until about a month before she passed away. So when all of this was happening, I decided I really wanted to put together a comprehensive piece on cancer prevention. Now, the nutrition part was where I started, where I delved in, and I think that's a component that a lot of people are interested in. But then I also wanted to make sure I was doing due diligence to other things that could help prevent cancer, like things like taking certain vitamins and supplements, looking for things in our environment that could be potential toxins. And then on the flip side, ways that we can detoxify our bodies to help get rid of some of those toxins, or at least give our bodies a fighting chance when we are exposed to toxins. So I know that was a long answer to your question, Janelle.
No, but that's good. And I'm excited to kind of dig deeper into the specifics. But really quick, I want to back up and just talk about, you mentioned, well, there's a couple things. So one that I want to talk about is that moment of, being at home, and you've always wanted to be at home. And then this, I think a lot of moms have this, and they're like, yes, I'm home. Wait, I'm home all day, every day. And like, no one even knows if I brushed my teeth today.
No, exactly.
It's just this definite adjustment. And so, a lot of, I think that we as moms can then pursue our passions. I think that stay-at-home moms are in such a unique and wonderful position to get to be creative and to do things, because if you are lucky enough to stay at home, that means your husband is probably working and bringing in enough money to support your family. And so you get to do passion projects. You get to do things because you want to. And so that's a really neat thing. And I love that this led you to cancer study specifically. I think that's amazing. And, I think that's really cool that that's something that interests you so much.
Yeah, it was definitely, I just want to say that it was certainly a blessing that I was able to do that. And I know so many women aren't able to just stop working. And so, I have to give due diligence to that too. That,
yes. Yeah,
it was a tremendous blessing for me to do that. But I also, like you said, I'm trying to use that in this time in my life to, try to help other people as well.
Yeah, which is awesome. Mm-hmm. Now, the next thing that I want to ask you is, I think that when you have a family history of cancer, or you get a diagnosis, or someone very close to you has cancer, then you start to think about it. Oh gosh, what can I do to prevent cancer? When you're generally healthy and you aren't so worried about cancer, I think it's easy to, say, maybe people will even look at the topic of this podcast, cancer prevention, whatever I decide to name it, something along those lines. And they'll say, oh, that one's not for me. I don't have cancer. What would you say to people like that? How do you spark someone's interest and help them to want to work on cancer prevention? Because you have to work on it ahead of time, right?
That's right. Well, exactly. That's the main thing here is that, in my book, I state that it has been shown that like 90 to 95% of cancers can be avoided. That's insane, right? I mean, that is just an absurdly high number. And, there are certain, people that might carry a gene, for example, the breast cancer gene, the BRCA gene, that would present them, to have a higher diagnosis risk. But the majority of the population, even if your mother has had something or your father has had something, that does not mean that you're going to get that. So yeah, if you don't have that, or if you don't have cancer in your background, you might be thinking, well, why does this pertain to me? It pertains to everybody because our environment is becoming more and more toxic, unfortunately. There are so many chemicals in, beauty supplies and cleaning products, in the air we breathe, and even in our water, like in our tap water, that we are exposed to toxins all the time. And if you couple that with the toxins we are taking in through the standard American diet, and I'm talking about things that are like GMO products. I'm talking about the high amounts of sugar that we are getting either straight from sugary sources or from just processed foods that we're eating. All of the damaged oils that are in so many of our food products. We are inundated with toxins in our environment and we don't even know it. And so, yeah, you might be thinking, well, I don't have a history of cancer, but most of us don't. And, and if you do, if you have a mother or a father that had cancer, that does not mean that you're going to get it because, like I said, 90 to 95% of them can be avoided. So genes don't even play that much of a role in the development of cancer. It's our everyday decisions in our everyday lives.
I like that. Okay. I like that because it gives us the power back. Yeah. So you can say, it doesn't matter what's in your family. You get to choose. Do you want to be proactive about this or not? And so I love that. Okay. And I think that's great because people can keep that in mind as they listen, well, what am I going to do? Do I want to make proactive, positive steps in my life to keep myself healthy? Now, the next thing that comes up in my mind is, as you're talking, there's toxins all around. We have a crummy diet in our country. Now, there is a tendency, I think, for sometimes when we hear all that, we want to just throw in the towel and say, well, forget it. It's too much. There's too much. I feel overwhelmed by all these risks. And so let's start with some actionable steps. So the most powerful, and I think that you already had mentioned is food. Did you say that?
Yes. Yeah, for sure.
Okay. So food. So let's start with that. So what can we do and change in our diet specifically that is really going to help with cancer prevention?
I love the way you phrased that question. First of all, I just want to say, because we do, even in writing this book, I was getting very overwhelmed, as you can imagine, diving into this deeply. Yeah. So what I do like to say to people is, it's not all doom and gloom. We can make proactive steps today. And a lot of it is adding things rather than taking away. We don't have to be depriving ourselves of, everything or completely overhauling everything. What we can do is to make little steps in the right direction by adding things in. So some of the foods that you can add in. So some of the anti-angiogenic foods, again, these are foods that have been studied to shown to turn off blood vessel flow to cancerous tumors. A lot of them are things that you probably already know, certain fruits and vegetables. But specifically some things like berries, cherries, apples, red grapes, very dark green vegetables, kale, bok choy. One of my favorites, beets. That's sort of like a trendy one these days. I like to use a beet powder. But you can also make, beets and arugula salads. There are a lot of spices. I just want to throw in,
that is like a favorite food of mine. Beet and arugula salad. Oh, love it.
I know, me too. I actually just, like a couple of weeks ago, put a recipe on my website for that because I love it so much.
So good. With a little feta or goat cheese in there. Those
goat cheese
together.
is my favorite. I know. Yep,
So
I totally agree. Yep, I put the goat cheese on mine, right. A lot of spices have also been studied. So you probably heard of turmeric or turmeric, however you want to say that. That's one that also is actually a very beneficial supplement that you can take. But it's great to add into cooking. Nutmeg, cinnamon, licorice, even. So a lot of spices have been shown and studied to be really beneficial in that fight against cancer. Other things that people may be interested in, red wine is one. And again, that comes with a caveat of, you never want to overconsume alcohol because then that becomes a cancer risk. So,
so limited.
Limited red wine, right? And, when it comes to heart health, they always say, 1 glass a day for women, 2 for men is fine. The cancer research is a little bit more conservative. And they really would say 1 to 2 a week is better for women and maybe 3 to 4 a week for men. So just if you're worried about cancer. But red wine is shown to be very beneficial. Green tea, of course, olive oil, is one that it's one of those we know to be a good fat, but it's also been shown to be very beneficial in cancer prevention. So those are, and dark chocolate's another one I like to mention because I feel like, you actually can feel like you're treating yourself a little bit too by adding these things in. Very dark chocolate, 70, 80, 90%. The darker, the better. Those are all great. So those are some anti-angiogenic ones. There are other cancer preventative foods, which, would be because of their high antioxidant levels. Things like, coffee, salmon, cruciferous vegetables, nuts, and, anything fermented, kimchi, sauerkraut, grass-fed beef, bone broth, organ meats from grass-fed animals. So really nutrient-dense things are all going to be really beneficial in your fight against cancer.
Okay, as you're talking and making this list, I'm thinking about how this list is also very similar to what I would list for, if you wanted to lose weight, if you wanted to be healthy, if you wanted to have a healthier heart, if you wanted to have a healthier brain. And it's just so interesting, these are specific anti-angiogenic foods. It's a new word to me. Okay.
Right.
But they are so much broader than that. And so even if you're willing to play the odds with cancer, it's your whole life. It's your health of your entire body, your brain, your muscles, everything is affected by what we eat. And that also is related to cancer prevention.
Exactly. And that's so true. And really, I think that's one of the hallmark things I think I realized when writing this book is that, when we can do something to prevent one disease, we're likely preventing multiple diseases. So I think it's extremely true. Weight loss, heart disease, diabetes, all of the, this adding these foods in, is so helpful. And I think I was listening not too long ago to your podcast with Jonathan Baylor.
Oh, yeah.
Is that his name? Yeah.
Yes.
And you were talking about just adding so many, green vegetables and trying to and I just think that's such a good thing. Even if you feel like you can't take away all of those packaged foods, if you need to have a treat here and there, if you can just focus on adding more vegetables into your diet, then you're really going above and beyond, what most people are able to do.
Yeah. And what I've found on that note is it's amazing because as you add more, then you're full and then you're not going to be as hungry for the junk food, but it's so much easier. And he said on that show something about you can't pursue a negative goal. And I love that because you can never cross off your list, don't eat cake today, but you can say, eat a vegetable with every meal. Well, I can do that. That's something you can get done and it's doable and it's going to help you with so many health related things. So yes, I love that whole concept of adding more good stuff. It's huge.
Right. Exactly. Did you
Yes.
want me to talk about things to avoid, or?
Yes. So tell us a little bit about that. Let's go into that. So some specifics that are specifically known to cause or be correlated with cancer.
So the main one is sugar. Sugar, sugar, sugar. It is so addictive. It's in everything, in so many packaged and processed foods. Even when you think about, crackers and breads and things you don't necessarily associate with sugar, what those break down to in our bodies is sugar. And so they spike our insulin levels. Having high insulin levels is not good. Of course, you think about diabetes, but that also has an association with cancer as well. So sugar really can be at the root cause of every cancer. In my book, I kind of go into various cancers or certain foods that have been studied, like, this food has been associated with this cancer. Well, sugar basically is at the root of every cancer because sugar inflames us from the inside out, and inflammation is what causes cancer. So that if there's one thing that you can avoid is absolutely the added sugars. You really, really are not doing yourselves any favor by having a drawer of candy in your house. If you're going to be out and about and once in a while, you have a treat, then that's fine. But when you're keeping it in the house, and, I have to say it's hard because, I have little boys and, sometimes sugar ends up in our house, and my gosh, you can just see because they have no idea, they don't really understand the detriments of that yet. Once they start eating it, it's like, can I have another one? Can I have another one? Can I have another? It's so addictive. And it really is addictive for all of us. And it's not a willpower thing. It really is a biochemical thing. So we have to really do ourselves justice and try to get rid of as much sugar as possible. And then I had mentioned earlier, just the processed vegetable oils, damaged oils like canola oil, soybean oil. When those oils are used, when they are, bottled, broken down, refined, they are damaged in the process. And that creates an oxidative process in our bodies when we're taking in those oils. So again, this oxidation leads to inflammation, which leads to cancer. So those oils, you might think of cooking with canola oil or soybean oil, but I'm talking about those products that you buy off the shelves. So take a look at the crackers that you have. I bet they say soybean oil or even the breads that you're eating. So you have to be really, really careful. And I think probably what this all comes down to is really trying to eat less packaged and boxed foods and trying to, like you said, cook more whole foods and things that, come really from nature.
Yeah. And I'll just add in here, one thing that I think prevents people from eating healthy sometimes is they're like, well, it's just so much more work. It's easier to buy frozen chicken nuggets or whatever else that's easy. But I've found it can be just as easy to cook real food. I'm a big believer in real food, and I'm a big believer in simple real food. And I buy frozen vegetables and I roast them, which is like the simplest, tastiest thing you can do. And you can get good meat and throw it in the crock pot. And there are easy ways to do it. And maybe it'll be a little learning curve, but it's definitely doable, and it doesn't have to be hard.
I love that. I think that's so true. I am not a cook, but I inherently am so simple. And I need to be just having, little ones at home who can't really leave me alone when I'm trying to cook. So like you said, just, slow roasting meats, in your crock pot, or just taking some ground grass-fed beef and making, just one pot dishes. I love that you said about frozen vegetables. They're so easy and they're already cut. Yeah. They're already cut for you, and they're just, it couldn't be any easier. And they are just as good because they're flash frozen. So they haven't lost any of their nutrient qualities just because they're frozen. So, I love that. I think it really, of course it's easy to open a bag of chips and, go to town on those, but it's really not that hard. Believe me, I am not one who's going to spend an hour in the kitchen making dinner. I'm just not, 15, 20 minutes, that's tops for me. So, I mean, maybe it'll cook in the oven longer or in the crock pot, but as far as
But as far as
preparation,
hands-on time.
yes, right, exactly. Yeah.
Totally.
So I love that.
Good. Yeah. And it's hopeful because it's like, okay, I can do that. I can do that. It's not too hard and it's not too time consuming. Now, we are already almost out of time. And so in the last little bit of time we have, I want you to just kind of talk to us about ways that moms can care for themselves and keep themselves and their families healthy. So just broad lifestyle things, whatever you want to kind of throw in there of what we can do. So we've talked a lot about food, but what else in our life can we do?
Well, I think, for one, like we talked about, so adding things rather than taking away. We could go into like all of the toxins that are in our environment, but let's talk instead about things we can do to detox our bodies that are easy. And so one I like to tell everybody, and this is super, super simple, but it's so helpful, is drink lemon water first thing in the morning. So, and if you're warming it, that's great, in the wintertime, or if it's, in the summertime and it's cool. But that's one thing. It can start your digestive juices going, and that's one way of flushing toxins out of our body. And the lemon has some added benefits as well. So what I like to do is I put on my nightstand the night before, I fill up a big glass of water and I put lemon in it. Because when you wake up in the morning and your mouth tastes so gross and you don't really want to just drink regular water, but that lemon is so flavorful and it feels like it cleanses your mouth. And that's one way of, of getting 10, 12, 14 ounces, super fast into your body. And it really helps. Hydration is so, so, so big and so important in prevention of disease too. So that's one really easy thing to do. I also like to say, to add some, if you can, either then or later, add some Himalayan sea salt to the water. Himalayan sea salt, just a sprinkle, is so packed with micronutrients so that if you're deficient at all, it really helps to bring those electrolytes into your body and some of those micro minerals that we may be deficient in. So it's a really good and useful tip. And then just any kind of exercise that you can get. It doesn't have to be long. It doesn't have to be running, but just anything that's going to get your heart rate going, that will make you perspire a little bit. So going for, like a walk, or, I mean, if you can do something like a HIIT exercise or a HIIT workout or lifting weights, those are all great. But exercise is so important for many reasons, because sweating helps to rid ourselves of toxins. It helps our lymphatic system. Our lymphatic system clears out toxins from our body. When someone has cancer and they say, oh, we have to remove these lymph nodes, it's because they store toxins in them. So if we're up and moving around, our circulation helps our lymphatic system to also detox. So, and then it also is just
question on that one.
Yeah.
Is it a combination of the sweat and the movement through the body? So, okay. Yes. So it's not like some days.
Sweating is fine too. It's okay to sweat. You can go into a sauna, and that's a great detoxification too.
So you're detoxing both from sweating and from moving the body in general.
That's right. Okay. And then you have the added bonus of it being a good stress relief too, that it has those biochemical changes, because stress, you can't undermine the importance of that. Having a high stress level is very toxic to your body too. It does things, it inflames your body as well. So having an outlet for stress relief is super, super important. So even if so that's why I just say exercise, because it has so many different things. And I know not everybody has time, but even a few times a week to try that. But if you don't have time, even doing deep breathing exercises, is so good for stress relief. Taking an Epsom salt bath, because you're getting that magnesium into you, and it helps to detoxify as well. So there are a lot of ways we can detoxify our body that, don't involve, detoxes and these super dietary cleanses and juice fasts. And it doesn't have to be anything like that. You can certainly do those once in a while, but things that help, that you would think of as self-care, exercise, writing in a gratitude journal, prayer, meditation, deep breathing, if you've heard of tapping, all of those things are really, really, really so good for you and actually do help to detoxify your body, because part of detoxification is also ridding yourself of stress.
I love that. You reminded me of so many things that I have had in my life and I used to have as habits that I've let go for different reasons. I used to have lemon water every single morning and I don't do that anymore. And I used to, what was the other? Oh, Epsom salt baths. I used to do those quite a bit and I ran out of Epsom salt and I just never got any more. And so it's good to be reminded. And for some people, some of these things might be new, but these are awesome things and they're not hard and they're fun, and I want to point out one thing that I just think is super useful. And that is, I love that you said that you put your water by your bedside the night before. When you can do things to make it easy and to just no problem, right? It doesn't matter if your kid wakes up early and you're thrown off your game, your water is there. You're going to drink it because it's there. And so anything we can do to just automate those healthy things we want in our life is going to make it that much easier and it's going to make it happen. So I am going to work on some of these, getting those habits back into my morning. I lost some of those with my pregnancy and I just have never gotten them back. So it's good for me to be reminded of those things. There's so much good stuff and I love the research that you've done. Your book is very well written and really a lot of research went into that book. So I haven't finished the whole thing, but I've been able to read a part of it and definitely impressed with Kim's work. So all of you, Kim, tell us the title again, and I'll definitely link to the book.
Okay, sure. So it's called 360 Health, and it's your guide to cancer prevention, healing foods, and total body wellness.
Awesome. Well, I love it. And I think that you've given us not only actionable tips, which I always appreciate. I love things that you can walk away and be just a little bit better and do just a little bit better for having heard the podcast. But also you've given us a reason why it's important, why we should care. You said something about disease, that when we have one disease, we often have other diseases that come along with that. And so I think that cancer prevention is more than just cancer prevention. It's also health, it's taking care of our health. It's making sure that we are healthy and it's preventing really a lot of things and feeling much better in the process. Kim, thank you so much for sharing your wisdom with us today. I appreciate it.
Oh, thank you so much for having me. It was really wonderful talking to you.
Yes, and thank you everyone for listening to Moms Who Know. Visit momswhoknowpodcast.com for show notes, and while you're there, be sure to get your copy of The Busy Mom's Guide to Effortless Weight Loss Without the Cravings. It's a free download and video training that will help you get in the best shape of your life. Tune in on Monday for the next episode of the Moms Who Know podcast.